Many thanks, Blessings. Joining me on the news is Dr. Ganiyat Oyeleke, consultant physician, Gastro-entero-logist, and He-pa-tologist at the Lagos University Teaching Hospital in Nigeria. Many thanks for joining us. Let's begin with this year's theme, I Can't Wait. What should we know about it?
Good evening, everyone, and thank you for having me. The theme for this year's World Hepatitis Day by the World Hepatitis Alliance is I cannot wait. I can't wait. I can't wait to get tested. I can't wait to get treated. I can't wait to get protected. I can't wait to get information about hepatitis. The world should not wait. I think the message is for everyone to take action. We shouldn't delay. We should go ahead and get tested if you haven't tested. Don't wait to get treated if you've tested positive. Do not wait to educate others about the dangers of hepatitis and the needs to have it done if you haven't done so. And also, do not wait to educate people about preventing stigmatization and discrimination against hepatitis. So they are actually, yeah, please
go ahead. Go ahead.
Yeah, so this is just one of the themes, like I said. The I can't wait is the theme of the World Hepatitis Alliance. The World Health Organization, WHO, they have a slightly different theme, which is bringing hepatitis care closer to you. And it is important to note that not so many people have access to hepatitis care. Not many people have access to testing of hepatitis, even in education and information and awareness of hepatitis B. So we're hoping that by advocacy, by discussing more about this, by educating more, by creating awareness, people would know where to go to test. People will not wait or delay if they've tested to get treated. And people shouldn't wait to disseminate information and prevent stigmatization. Thank you.
I mean, very, very important themes, anyhow you look at it. But can you impress on us the statistics of African countries and the severity of hepatitis we have, and why it is imperative that attention must be focused and awareness created?
Thank you very much. And as you heard the opening statement, the message by the World Health Organization of the impact, the global impact of hepatitis. In Africa, chronic viral hepatitis affects about 70 million Africans. About 60 million of this is hepatitis B, while about 10 million with hepatitis C. It's important to know that this is a significant population of, compared to the total world population of infection of about 350. So if you have like 70, 1 in 5 in Africa alone. Hepatitis B is preventable, is treatable. Hepatitis C is now curable. So it's important that we know that in Africa, particularly sub-Saharan Africa, where most of this, either hepatitis B or hepatitis C, they cause over 90% of people living with hepatitis B and C in Africa. They lack the much needed care that they need to have. So you understand the magnitude of the quantity of the number of people that have it, and the fact that most of these people do not even know that they have it. And fewer than 1 in 10 people in Africa, they have access to testing and treatments. So the disease often progresses to advanced liver disease. You mentioned liver cirrhosis, which is advanced scarring within the liver, and even hepatocellular carcinoma, which is just liver cancer. So it's important for us to know that it is problematic in Africa, particularly in sub-Saharan Africa. It results in about 200,000 deaths a year in Africa, and often among the continent's most youthful and productive population. This is a big issue in Africa. particularly sub-Saharan Africa.
Okay, there's an other issue of concern that has been raised. It has to do with the awareness given to a birth dose vaccination. How can this be improved?
Yeah, thank you. So, birth dose vaccination has been a key focus of the strategy to expand hepatitis B vaccination services and to include universal new birth hepatitis B vaccination. And this has been shown to of course, overall reduce the incidence of hepatitis. The awareness and the uptake has been low, and studies, only very few countries like Rwanda and probably Southern Africa has very good uptake. Nigeria, we still have a few challenges. In West Africa, incidence of hepatitis B infections are the countries that have provided adequate birth dose of this vaccine. So it's important that we find a way to increase the awareness, the level of awareness. But by doing so, we need to understand the challenges.
Dr. Oyeleke, if you can hear me, I'm just going to ask you to give some pointers for those who just got a diagnosis of hepatitis. What should they do?
Yeah, so for those that have been diagnosed with hepatitis B, the first thing that they should know is that they shouldn't panic, because people tend to worry and they tend to hide either self stigma or they are worried about what people would say and all that. So there's no need to panic. Information, and you need to go to the hospital to get further tests done. The advantage of doing further tests is to check if there's infection, the liver infection has already affected the liver and caused damage to the liver, or if there are other associated conditions and complications. Treatment may be required in some cases after the various other tests have been done and the person has been examined. And not everybody will require treatment for hepatitis B. So it's important that you don't just keep this to yourself. You need to go to the hospital, do some further tests. There's treatment. Hepatitis is a treatable condition. It is not an end of life situation. So you need to also come out and talk a lot about this. Okay. It is not something you keep to yourself, and you have to also treat other family members and test them too. Thank you.
I think that's a good spot to leave it. Thank you very much, Dr. Oyeleke, for speaking with us on this subject.